Acute cholecystitis. Let's define it. The word itself defines it. Acute is of sudden onset, right? Chole, the word refers to gallbladder. The word which ends in itis refers to inflammation. Now, let's define this acute cholecystitis. It is an acute diffuse inflammation of the gallbladder. Okay, and there are two types based upon whether the inflammation is associated with a gallstone or it is not associated with a gallstone. There are two types: acute calculous cholecystitis and acalculous cholecystitis. Right? Now let's discuss about the pathogenesis of acute calculous cholecystitis. Look at this picture. The two places, the neck of the bladder and the cystic duct, note it down, okay? When there is obstruction in these two places, a lot of complications takes place. And we say that those complications are the acute inflammations, okay? And acute inflammation is not a solo or self-developed characteristic in a gallbladder. It occurs secondary to obstruction in this neck and cystic duct in 90% of cases. Rarely in other 10% of cases, it takes place in obstruction in some other places. Okay? Now, the inflammation of gallbladder, we are going to discuss it in three broad topics: chemical inflammation, mechanical inflammation, and bacterial inflammation. First, chemical inflammation. The word itself says chemical inflammation. So, for the inflammation, the reason is chemical irritation. Let's see what are all those chemicals which cause irritation and which leads to inflammation. Okay, first, the epithelium of gallbladder secretes a compound called as phospholipase. Okay, and inside the gallbladder there is bile, and this bile contains lecithin. This phospholipase acts upon lecithin over a period of time because due to obstruction, the bile is inside the bladder for a long time, right? They form a compound called as lysolecithin. This is very toxic, and this toxic compound leads to chemical inflammation. Okay, this is one possibility. Next, decreased glycoprotein. Let's see what is glycoprotein, what is its role. The gallbladder's mucosa secretes a compound called as glycoprotein. Okay, this has some protective role. It protects against the bile salts. What happens is that let's imagine there is a situation that there is a decreased production of glycoproteins. This leads to direct mucosal damage. You know how? The bile salts gets concentrated inside, right? These concentrated bile salts has a detergent property, detergent action. We have learned it in physiology, reminded here. So due to this action, there is direct mucosal damage. The next possibility is supersaturation of bile with cholesterol. Then prostaglandins. The gallbladder gets distended time by time. And this distended gallbladder secretes a compound called as prostaglandin. This prostaglandin has inflammatory property. Okay, so that's it. So these are some possibilities for chemical inflammation. Now let's see what is mechanical inflammation. First, there is obstruction. Whenever there is obstruction in the cystic duct, pressure, intraluminal pressure increases. When this pressure increases, this leads to distension of the gallbladder and the motility of the gallbladder decreases, right? Finally, all these leads to venous flow obstruction. When venous flow obstruction takes place, there is ischemia in the gallbladder mucosa and walls, and there is inflammation, right? The last one is bacterial inflammation. Bacterial invasion is not a primary event, it's a secondary event. Okay, and the most frequent organisms are E. coli, Klebsiella, Streptococcus, and Clostridium. So, thank you guys for further microscopic and clinical features and for the acalculous cholecystitis. Wait for the next video, we will see in that. Thank you. Subscribe to the channel.